is Q13 Fox News This Morning.
7:50 right now. By 2031, in 5 Washingtonians will be over the age of 65.
What might have been stashed away for retirement years ago may now not be enough. Coming up next, we speak to an expert about how to better prepare for the golden years. Good morning and welcome to Q13 Fox News This Morning. The baby boomer generation is getting older. In 2011, the first baby boomer turned 65, and for the next 18 years, 8,000 baby boomers will reach retirement age every single day.
And as you can imagine, this is creating a major burden on our healthcare industry that simply can't keep up with the growing demand. And you look at your aging parents, and a lot of the time, that financing is going to be on you. So the Washington Healthcare Association meeting this week to discuss this issue and many others. Joining us now, Robin Dale, the head of the Washington Healthcare Association. Good morning to you, sir.
Good morning. Thank you for having me.
Good to have you here. And we just talked about some of those daunting numbers in terms of healthcare. People are living longer than ever. This is a major financial burden for so many people and so many families.
Yeah, it's a huge issue. And what we're used to, or what we want to think about, is that we've got a safety net in place. But what people need to understand is that safety net is unraveling. And we need to address that, or we're going to be in for some major problems in years ahead.
And we understand Medicare is not enough to cover this, especially when it comes to long-term medical bills, assisted living facilities.
Right. Medicare itself is going to handle some of this, but only for a brief period of time once you're out of the hospital. The major driver for this industry, nursing homes and assisted living, is Medicaid, which is a state program which 70% of the seniors in a nursing home are relying on Medicaid to some degree.
This is a major issue for just about every family. I mean, it's something you have to address at a certain point. All of our parents are getting older, and so often something happens and then it's on the family to pick it up. It's a conversation that everybody should have. When should we have this conversation, and how do we have it?
Well, you should have the conversation as soon as you can. I went through this with my own mother when we were looking for nursing home care for her. And at that point, we really didn't know how much money she had. When we found out, we realized that she would only be able to be in this nursing home private pay for approximately 6 months. And so we had to make sure that we had a place for her to go where she could be there for private pay for that period of time, and then flip over to Medicaid, which took care of her for her last days. So you've really got to look, plan, and go to these communities and see what they're like.
So what is the solution? What can we do? What can lawmakers do?
The solution is for everyone to call their lawmaker, 1-800-562-6000. Tell them that they need to address the Medicaid issue and make sure that the safety net for our seniors stays in place.
So much has been made of health care over the last year, especially with Obamacare passing, and then the Supreme Court decision about that. And this part of it has not really been addressed, which is interesting.
Yeah, it's not. They're hoping to finance some of this with quote-unquote savings from the Affordable Care Act, but I think those are just projections, and we've got to do something in this state now to protect our seniors.
Robin Dale with the Washington Healthcare Association, thank you. Good to have you. And for more information, go to WHCA.org.